Hepiniz hoş geldiniz. Günün son oturumunda bu kadar kalabalığı görmek.
Thank you very much. It's very nice to see such a crowd at this late hour of the evening, and I'm a bit excited to tell you the truth. I would like to thank you, organizers, dear organizers. Thank you so much for this great organization, and thank you for accepting our presentation. Oxytocin and vasopressin are among the hot topics of the recent years, and in this session I'll try to mention oxytocin and vasopressin in this ADHD and conduct disorder. There is a frame of a window. I intentionally put this on the slide because I'm going to provide my humble ideas from this framework, this window. Okay, this is my perspective. Oxytocin and vasopressin, what are the effects of these two drugs, two elements in ADHD and conduct disorder? Oxytocin and vasopressin are synthesized from hypothalamus, and they show their peripheral effects through this pathway. It has 9 peptides. Only 2 amino acids of these 2 hormones are different. They have different peripheral effects. When you look at the slide, you can see that oxytocin increases social contact, induction, partner preference formation can be increased by oxytocin. It decreases aggression. Animals given oxytocin show a decrease in their aggression level. It decreases anxiety. It decreases glucocorticoids release. It increases certain contractions, muscular contractions during birth, and birth is improved and made easier. Reproduction, sexual behaviors, sensory processing, these are increased thanks to oxytocin, and it increases memory process and functions. It also increases some sexual functions. Vasopressin is responsible for these actions in addition to oxytocin. From neurobiological perspective, oxytocin and HPX, there is a big relation. Oxytocin and dopamine has an interaction on the neurobiological level from the brain areas wise. We know that oxytocin affects amygdala, hypothalamus, medial frontal cortex. Majority of the areas of the brain is affected by oxytocin. Thanks to oxytocin, we can decrease social anxiety and we can have an increased social interaction. It increases emotion definition, recognition, and empathy is increased, and dependency and psychosis change thanks to the increase of the dopamine. And oxytocin is very important, as you can appreciate. Thus, it is normal to have more research on oxytocin. In 2009, a meta-analysis was carried out, and in 2015, schizophrenia and oxytocin were researched in the OCB receptors of oxytocin was researched, and my friends will deliver some speech about anxiety disorders and oxytocin affective disorders. We know that in many of the disorders, oxytocin plays big role, and it has been researched for many times. Vasopressin is related to autism spectrum disorder, social anxiety, schizophrenia, PTSD. We know that vasopressin is thought to be in relation with many psychiatric disorders. Based on these trials, we can say that oxytocin and vasopressin can be accepted as a biomarker for many of the psychiatric disorders. From the behavioral disorder perspective, I can say that vasopressin is not a very popular discussion topic, but in genetic trials, vasopressin has thought to be effective on the aggression. Vasopressin 1 receptor has polymorphism, and the second trial was carried out in 2009. In the ADHD, vasopressin receptor gene was analyzed, and here a polymorphism was shown. Ongoing studies focused on aggression rather than ADHD and other disorders, behavioral disorders, were found to be in relation with vasopressin levels. In the ADHD kids, plasma and vasopressin levels were analyzed. In this trial, 30 ADHD diagnosed kids were evaluated, and 34 healthy patients were included. It was a mixed-type ADHD. Connors, parents and teachers forms were given. As a result of this trial, both on females and males, plasma and vasopressin levels, there has been no difference between vasopressin and plasma levels. All in all, in the genetic trials, vasopressin 1 shows some polymorphisms, but in the blood tests, there has been no difference when it comes to ADHD. I think it is in need of further research, and there are many trials about oxytocin. We can see 4 trials. 3 of them are related to blood levels. In 2004, Taurus and friends carried out a study, and you can see the number of the patients is very low, 19 patients. ADHD, males, children have been analyzed, and 19 of them had ADHD. 3 different types of ADHD have been analyzed, and the results have been published on the article. And the result of this trial is as follows. Compared to control group, on the ADHD group, oxytocin level is lower. In the oxytocin levels in the autism and ADHD, we can see some differences. And some of the patients among this patient groups are drug users, by the way. Sasaki et al. Carried out a study in 2005, and it is related to decreased levels of serum oxytocin in pediatric patients with attention deficit hyperactivity disorder. 13 of them previous drug users, and the rest of them are no users. Serum oxytocin levels of the drug users have lower levels. Probably because of the number changes, we can see the effect. Okay, you can see this is from Kayseri. It is on the serum oxytocin levels in male children and adolescents with attention deficit and hyperactivity disorder. 40 ADHD male and 40 healthy males are included, and Connors parents scoring evaluated the results. 3 different types of ADHD are included to this trial. In the ADHD group, here, I'm not sure whether it is visible or not, but serum oxytocin levels compared to control group has significantly lower values than the control group. And in addition to this, controlled groups have been analyzed. Aggression scores have negative correlation with oxytocin levels, and serum oxytocin levels have positive correlation with empathy. So aggression has negative correlation, empathy has positive correlation with oxytocin levels. When it comes to behavioral disorders, there are 4 gene trials and 2 blood trials. Some abnormalities were evaluated. High abnormality scores were found. Oxytocin receptor gene and behavioral disorders have been analyzed, and there is no relation with oxytocin levels in behavioral disorders. And oxytocin receptor gene polymorphism is evaluated. At the age of 15, there are more elevations of the behavioral disorders, and these people have worsened behavioral disorders at the age of 23. Prenatal and postnatal risks are evaluated in the 4th group during birth and age 9 and age 13 periods of an ADHD person has been evaluated. Oxytocin methylation during birth is related to callus abnormalities at the age of 13. So if there are some problems during pregnancy or birth, that infant will develop more problems at the age of 13 if there are some pathologies of the parent, if there is the misuse or abuse of drug or substance of the parents, then the kid will develop more problematic behavioral disorders at the age of 13. Oxytocin receptor methylation is becoming stabilized with the age. And we'll look at blood trials. It is from 2014. Here you can see behavioral disorder males between 4 and 16 ages are evaluated. Low callus abnormalities, high callus abnormalities are evaluated, and you can see high increased levels of abnormalities have been found to be related with low levels of oxytocin. It is from 2015. This trial is salivary oxytocin in adolescents with conduct problems and callous emotional traits. Bragg-Woodwing survey was applied. Oxytocin levels, oxytocin and saliva levels with the behavioral disorder scores, there's negative correlation. Graph is not very clear, but the higher the score is, the less the salivary oxytocin level is. Okay, what have we done? It is from European Neuropsychiatry magazine. On the ADHD and behavioral disorders diagnosed individuals, we analyzed serum oxytocin levels. Comorbidity was indispensable. If we had excluded comorbidities, we thought that we would not have sufficient number of participants. That's why comorbidities were not excluded. All kinds of traits were scanned for our trial, and we included the ADHD, the behavioral disorder, and healthy groups. So there were 3 groups in our trial. Anxiety, depression, and aggression scores are evaluated, and self-notification surveys have been distributed to the kids and their parents. Mental retardation was eliminated, and we evaluated some of their values. You can see inclusion, exclusion criteria, being non-alcoholic, and some hormonal factors, so these were excluded. And at the end we have found that between girls and boys, on the body mass index, on the age, there are no significant differences, but depression and anxiety showed big differences among groups. So these two are accepted as covariants. When we compare these three groups compared to ADHD and control group, on the behavioral disorder group we have seen significantly lower serum oxytocin levels. When we control anxiety, depression, and other disorders, we figured out that serum oxytocin levels still becomes lower than the other groups. In the ADHD group, we have not seen any difference, and we thought that why this is different, why there is no difference in the ADHD, whether we don't see any effect from the serum oxytocin level in the ADHD. And we have thought about some methodological differences as well. In our trial, serum oxytocin levels on the behavioral disorder group compared to ADHD and the control group has found to be lower, and it is the first example of its kind. Dependency problems and empathy decrease can be caused by oxytocin levels, or it can be the reason for oxytocin levels. Dependency and empathy related problems can increase behavioral disorders, and they can take their roots from oxytocin levels. We have analyzed 3 different groups, as I mentioned, and our sampling size is very big compared to different groups. You can see the numbers of the participants, teachers, parents, and participants helped us. They gave information and feedback. Oxytocin levels decrease. We didn't know the real cause, whether it is because of the behavioral disorders or ADHD. We don't know it yet. We really do not know if it is reflecting the real oxytocin level on the brain or not. Blood samples were taken from 8 to 10. It is a question mark because of the circadian cycle. It is like an egg and kitchen problem. We don't know the answers yet. Thank you very much. If you have any questions, I'll be more than happy to answer them at the end of the session. Thank you very much.